Thanks for visiting. Let me go straight to PTSD treatment. There is a separate full presentation on PTSD. I have tagged that PTSD A to Z. If you have the time, you can click on this very link and that will take you to PTSD treatment, like I'm having right now. Signs and symptoms, diagnosis, risk factors, triggers, and many other pieces of info. So if you click on this link, that will take you there. Referral should be considered as early as possible. To who? To a psychiatrist, please. Is it curable? No. But some will get out of it within the first 1 year, some within the first 10 years, and some it will be chronic for a long time. But there's no cure. Who needs treatment? Anyone who is no longer in the phase of acute stress disorder will need treatment as PTSD affected individual. And let me explain here. ASD is acute stress disorder when we are subjected to a traumatic situation. We will have some signs and symptoms. But that is expected to last day 1 to 30. Once it is greater than a month, you are still having signs and symptoms triggered by the exposure to the traumatic event or events, then it's no longer acute stress disorder. It has become something else, and that is PTSD. Then we will also look for effects, complications, affecting occupation, marriage, or relationship. Is that the case? This individual needs treatment right now. Is it affecting activities of daily living or instrumental activities of daily living? You can no longer cater for yourself. You are so down as per the mood changes, depression. You need treatment right now. Still on who needs treatment, you are preoccupied with the thoughts and the feelings and the symptoms of this condition, then you need treatment right now. You can no longer sleep normally. Your sleep pattern has been altered. Maybe you are not getting to sleep, or you sleep, you are not getting enough, you are not refreshed, it's been disturbed one way or the other, you need treatment. Physical symptoms, sweating, headache, pains, name it. You need treatment right now. Mood changes is already here. We are now having more and more consciousness and awareness and anxiety, depression, and you are even becoming suicidal. In fact, must be admitted with suicidal ideation, suicidal thoughts. Be admitted and put under close observation. So the treatment will start with counseling. The history is already there. The diagnosis is already being made. Then the counselor will come in who will take care of that aspect based on the appropriate need of that particular individual. There could be distraction. It's a way of taking your mind off the video that is being replayed and continuously in your brain. Now, psychotherapy will be embarked upon. There is an entity known as child-parent psychotherapy for pediatric age group, and also exposure therapy, cognitive behavioral therapy, and then cognitive processing therapy, or some call it cognitive processing psychotherapy. So all these could be, made use of depending on the specific need of the individual and the direction that the psychotherapy will go. Physical exercise will help with relaxation and breathing. And now medications. The reason why I'm putting medications last is we should do what we can do without making use of medications, because there's no medication we are going to give that will not have side effects. But one group should not be used in PTSD patients, that is benzodiazepines. We should avoid it as much as we can. Antidepressants will likely be the call here. So we'll start the antidepressant with selective serotonin reuptake inhibitor like sertraline, paroxetine, or fluoxetine. Then norepinephrine, serotonin reuptake inhibitor like viloxazine could be tried. Insomnia could be handled with trazodone or prazosin for children, but watch the blood pressure, please. Other medications include clonidine, but please watch the blood pressure. Tricyclic antidepressant, but watch the anticholinergic effect and the horrible effect on the heart like arrhythmia. Monoamine oxidase inhibitor, please watch out for tyramine containing compound, food-related, or other medications that must not be used concomitantly with monoamine oxidase inhibitor, because many other medications will have to be taken off when the individual is on monoamine oxidase inhibitors, or at least 2 weeks will occur between the stoppage of monoamine oxidase inhibitor and the onset of a particular new medication. Find out from your pharmacist or from a clinical pharmacologist while making that determination. Mirtazapine is also helpful, and beta blockers, particularly in acute phase, will be helpful. But watch the BP, please. If you are dealing with refractory cases, you've used your antidepressant, you're not winning, then ketamine, riluzole, then some will use cannabis or synthetic cannabinoids, Nabilon. And of course, you still have the room there, Referra. I started with Referra, and I'm going to end with Referra. As a family physician handling this, you can be monitoring and make the definitive diagnosis, but if you refer early, it will help the patient more. What are the advantages of treatment? If someone has PTSD, why should a person seek help at all? It's going to improve your lifestyle, for sure. You'll be better off, okay, than the individual who will keep it under the table and they won't even discuss it with anyone. It's going to serve as impetus for others to seek help. When two people are exposed to the same traumatic events and they are not coming out of it in the first 30 days, they are both now PTSD patients, then one is seeking help, the other one is not seeking help. If the one seeking help is seen as improving, getting out of the trouble, now back with his wife or her husband or whatever the case may be, or getting back to job and life is getting better, playing with his or her children and so on, then the other one who is not seeking help might want to seek help now. Yeah. And this is pretty important. This is the reason why many people die. They don't want to seek help. The society will judge them. The stigma. No, nobody will believe them. Now, how will many people believe uh, lab technician to be having PTSD, or case of sexual assault when the story is not even believed in the first place. How would they believe that she's now having PTSD? So all these things could lead to untimely death. And of course, it's going to decrease suicide. Like when you seek help, they will know, the level of the depression. Then maybe you need immediate or urgent attention, including admission to, to the hospital to be probably monitored when you have suicidal ideation, suicidal thoughts, or attempted suicide. All those things will help in making determination and decrease the rate of suicide, because many with PTSD will end up committing suicide. With that, I've come to the end of this short presentation as per the treatment of PTSD. We can appropriate all these things, and the sufferers can now have improved lifestyle. Thanks for listening. Please remember to subscribe. I appreciate that.